seen lots of patients with low back pain. In fact, when I kind of tallied it up, I've seen over 10,000 patients over my career. I'd say about 40% of those are low back pain, another 20 to 25% neck pain, and then the rest are other joint conditions. So low back has been the most common reason people come to see us in the clinic. It's actually number one or number two for all doctor visits, including going to the hospital. So it's very prevalent. I read some statistics once saying that 40% of the population currently has back pain, and 80% has had back pain at some point in their lives. So that's how prevalent it is. So I'm just going to show you my slides here on our website. So just hold on as I switch over and show you my slide. Now, this is the core strength slide. Why would you want to do core strengthening? Well, you don't want to do that initially when you have back pain, because if you have back pain, you try to strengthen it, it could aggravate the back condition. So I wouldn't advise you to start doing core strengthening exercises if you currently have back pain and if it's not resolving or getting better. In fact, I would always talk to a health professional before starting something new. So don't just go out there and start doing these exercises today without talking to me if you're a patient of mine or your health professional. I'd be happy to find you a chiropractor in your area that does this kind of work. So why core strength? Well, it supports the spine, and there's muscles on either side of the spine, and there's 4 layers of muscles in the body, really tiny muscles going between the bones. There's larger muscles spanning many vertebrae. There's muscles that span a section, and then there's muscles that go over large areas in the body. So there's 4 groups of muscles, 4 layers, and we want these muscles supporting the spine and doing their work to prevent injury and improve your posture. So that's why we want to do core strengthening. It also supports the process in the clinic. So as we start treating you, you start feeling better, the range of motion is being restored. We want you to do some core strengthening to support the changes that we're making in the clinic. So I often tell my patients it's like 2 steps forward, 1 step back. And we want you to support that process of going 2 steps forward, 1 step back. So just getting a question here on Instagram. Thanks for your question. And you have a disc herniation, and is it good to do core strengthening exercises? It depends on when you had the disc herniation, what your symptoms currently are. I would definitely check with your doctor or health professional before you start doing any core strengthening. At some point, it's going to be very important for you, but without assessing you, I wouldn't know if this is the right time. We want to be a little extra careful with disc herniations because the disc is like a jelly donut, and the dough part in a herniation tears, and some of the fluid in the middle can start to leak into or squeeze through the dough. So we really want to make sure that that's stable. The repair process has started. The disc is stable and in good shape to be able to handle exercises like core strengthening. So just check with your doctor or health professional. And if you need a referral, please reach out to me after the webinar today, maybe DM me, and I'd be happy to help you. So what are some core strengthening exercises? Well, number one, the go-to for me is always the plank. I like the plank because it involves tightening your core and being parallel to the floor. And here on this picture, this lady has her body in a good position where it's very flat or parallel to the ground. She's on her toes. You can do this on your toes or even on your knees as well. And then the arms, she has her arms bent and she's leaning on her elbows. But sometimes what I find when I give the plank to patients is they let their lower body sag, or they're too high up, kind of overcompensating. So you want to make sure you get in the right position, have the muscles in the abdomen tightening, and the ones in the low back, and that just supports the spine and the spinal alignment. So keep your body level, parallel to the ground, hold for 10 to 30 seconds. I would start with 10 seconds if you're new to it, and then work your way up 11, 12, 13 seconds, each day until you get to 30. And then do 3 to 5 repetitions. The reason why you do repetitions is it gives the body a chance to heal, so you can rest a little bit, and then you can start again, because the lactic acid starts to build up in the muscles. I would do this first thing in the morning. And what I mean by that is when you get out of bed, have a drink of water, have a coffee, whatever you do, but then get into these exercises. Or you could do it before you have breakfast. That's a good time too. But you definitely want to, I call it anchoring. You want to anchor a new routine to an existing routine. So getting out of bed first thing in the morning, perfect, because you make this high priority, and then you want to be able to do this exercise and kind of get it out of the way. And I find that people that do it first thing in the morning are more consistent with their exercise routine. The second one is the bridge. I really like the bridge too. It's the kind of the opposite of the plank. So you're on your back, and you have your shoulders touching the ground, your neck and head are level, and then you lift the hips off the ground, forming a straight line between the knees and the shoulders. So this neutral position right here is very good. You don't want to put too much stress on the neck, so make sure you're not overcompensating on this one. And you don't want to be too low where the hips are sagging down to the ground. You don't have to have your heels off the ground like this. Actually, I wouldn't recommend that. So in this picture, the person has their heels lifted. Don't do that. Have your feet flat. That's fine. And just hold that position where the abdominals and the back extensor muscles are tight and supporting the spine. Okay, so you have that support on either side. Do 10 to 30 seconds again, 3 to 5 repetitions. Do it first thing in the morning. You might as well do it with the plank as well. And you have those 2 exercises done. The next one is the side plank, and you need to do this on both sides. Similar principle. Now this one I find for myself, on one side I have an easier time than the other because one of my sides are weak. So what you want to do is, in this case, this is a perfect way of doing it. Have the elbow bent. He's resting on his forearm. His feet are together, knees off the ground, and he's forming a straight line from his feet right up to his neck area. Actually, he should be looking straight ahead. Don't have your head down because that causes too much tension and flexion on the neck. Look straight ahead. And then hold the muscles on the sides of the spine nice and tight. So stabilize the spine. Keep the hips and the spine from sagging down or pushing up too high. Keep it nice and neutral. Tighten those muscles and hold. Hold that for 10 to 30 seconds. And then do that 3 to 5 times. Again, building yourself up. Start with 3 reps, 10 seconds each, and then work up in time, 11, 12, 13. And as you get up to like 15 seconds a day, 20 seconds a day, you could try to do an extra rep, maybe 4 reps of 15 or 20 seconds, just to give you an idea of how I'd work that up. Again, first thing in the morning is best. So when you get out of bed, do your exercise routine. And if you need to get up a little bit early, this will only take you 10 or 15 minutes. Just set the clock 10 or 15 minutes earlier, go to bed a little earlier, and you should be good. If you're interested in coming to our clinic in Kelowna, we do have a special offer for you today. You can use this code 15 off right here on the bottom, and you can book an appointment. So when you go to our website, and I think I have my website up, I can show you that in a second. You want to use the /15 off to book the appointment. So that'll give you $15 off the new patient appointment. It's for a limited time, so this may not last for a long period of time. But if you're in the area, you need some help, certainly use this website link, drcaryyurkiw.com /15 off. And when it asks you for the coupon code, 15 off is the coupon code. So that's pretty easy. Let's see if I can switch screens here just to show you our website, because we just redid our website, and I really like the format of it. So let me see if I can just pull it up here. Sorry guys, I had it up earlier. Okay, here it is. So I'm just going to click on that so you can see it on my screen. So here's our website right here. If you're on Instagram, go to the link in the bio and you can go to our website. And then here's our main screen. Here's who I am and why I became a chiropractor. There's some reviews on the bottom of the screen. So if you want to read some testimonials from my patients, they're right there. And then if you go to the 3 dashes right up here, you'll see our menu. To book an appointment, you just click on the appointment link right here. But before I do that, the events link is here. If you click on that, what you're going to see is the upcoming events. And today we just did the core strengthening webinar. But coming up on Sunday, it's Coffee with Dr. Cary. I'll be live. You can ask me your questions. Thank you very much for your question today. But you can ask me your questions live. And I'm usually live here on Instagram or on Twitter. So those are the 2 channels on social media. I usually go live. If it's a shorter one, sometimes on TikTok too, but it has to be under 3 minutes. So for Sunday, I'll probably be on Instagram live. And then next Tuesday, we have a free webinar called Yoga for Your Low Back and Legs. This will be to get flexibility in the low back, in the hips, and in the legs. The tickets are free. Just click on the Get Tickets. Just enter your info. You'll get emailed a ticket for the event, and then you just click on that ticket and come right into our webinar like you did today. If you miss a webinar, on the bottom in the store function right here, you should be able to access the past webinars because when we record them, we usually post them. I'm going to go to the shop function here on the website just so you can see that. Yeah, here's the videos right here in the shop function. And so you can click on this, any one of these videos, and you can see that. If it's a master class, you might have to rent that because those are paid events. Here's the books I've written up here: Neck Pain, Back Pain, and the 100-Day Diet. So those are the books that are on Amazon, where you can download them right from our website. And the last thing I'll show you is to book an appointment. You just go right here and you click on Book Now. And then when you do that, it's going to ask you for some info. So you're going to choose a day and you're going to choose a time, and then you'll go to Next. And then what you're going to do is you're going to enter your info here. And then when it says coupon code, just type in 15 off, and that'll get you $15 off the appointment. And then you'll get notified by our office that your appointment's booked. And then we'll send you the paperwork in advance. You can e-sign, it'll come back to us, and we'll be ready to go for your appointment. So thanks for joining me today, you guys. I look forward to talking to you again. Follow us on social media because I do post on a daily basis. Sign up for the upcoming webinars. Most of them are free. And then subscribe to our YouTube channel. It's at Dr. Cary Yurkiw on YouTube, as well as our podcast. It's called Super Healthy on Apple and Android, and we're on Spotify. So look for Super Healthy. That's our podcast, and you're going to get a lot of these types of webinars, the audio version, through our podcast. So thanks again for joining me today. I really appreciate you guys being here, and we'll talk to you soon.